you could be doing everything right on the outside. The right shampoo, the right oil, the scalp massages, the expensive serums that promise everything and deliver almost nothing. And still, month after month, more hair in the drain. More scalp showing through. More frustration. Here's what most people never get told. Sometimes the problem isn't on your scalp at all. It's inside your body. And no topical treatment in the world can fix a problem that starts from within. Today we're talking about the internal piece. The specific nutrients that research has directly linked to hair loss. The ones most doctors don't test for unless you ask. And the ones that could be silently sabotaging every external protocol you've ever tried. This isn't about expensive supplements with fancy labels. It's about understanding what your follicles actually need to do their job, and why, after 50, the odds of running low on at least one of these go up significantly. If you're not subscribed yet, hit the bell. The next video is going to cover a specific oil that researchers tested directly against minoxidil in a clinical trial. The results surprised a lot of people. Don't miss that one. But first, let's talk about what's happening inside a hair follicle when it starts to fail, because this is the part that changes everything. Your hair follicle is one of the most metabolically active structures in the human body. Think about that for a second. While you're sleeping, while you're sitting, while you're doing absolutely nothing, your follicles are working, dividing cells, building proteins, producing new hair. All of that requires a constant, uninterrupted supply of raw materials delivered through your bloodstream. When that supply drops, even slightly, even temporarily, follicles respond. They don't shut down immediately, they downgrade. They produce thinner hairs. They shorten the growth phase. They start shedding more than they should. And over time, if the deficiency continues, some of them stop producing altogether. The frustrating part? This can happen with nutrient levels that look normal on a standard blood panel, because standard tests don't always measure what's actually available inside your cells, only what's floating in your blood, and those are two very different things. This is the gap that dermatology research has been quietly documenting for years. Let's start with iron. Specifically, a form of stored iron called ferritin. Ferritin is the protein your body uses to store iron and release it when needed. And among all the nutrients linked to hair loss in the research literature, ferritin is one of the most consistently documented. In 2010, Dr. Elise Olson and colleagues at Duke University published a controlled study in the Journal of the American Academy of Dermatology, one of the most respected dermatology publications in the world, that examined iron deficiency in women with two of the most common forms of hair loss. The study involved over 380 women. The findings confirmed that iron deficiency is a common problem in women with hair loss, and that standard ferritin cutoffs used in general medicine may not be adequate for assessing hair health specifically. Here's the part most people don't know. A ferritin level can be low enough to affect your follicles while still technically falling within the normal range on a lab report. Different labs use different reference ranges. What counts as acceptable for general health may not be sufficient for the high metabolic demands of active hair follicles. If you've had blood work done and been told your iron is fine, it may be worth asking specifically about your ferritin level and asking your doctor what level is considered optimal for hair health, not just the minimum to avoid a diagnosis. The second nutrient is zinc. Zinc is involved in DNA synthesis, cell division, hormone regulation, and enzyme activity throughout the body. Inside the hair follicle specifically, research has shown that zinc acts as a potent inhibitor of follicle regression. It literally helps keep follicles in their active state longer, and accelerates follicle recovery when damage has occurred. A 2022 systematic review and meta-analysis published in the Journal of Cosmetic Dermatology analyzed the relationship between serum zinc levels and androgenetic alopecia, the most common form of pattern hair loss. The review found a consistent association between lower zinc levels and hair loss across multiple studies. A separate study published in PMC found that participants with active hair loss had significantly lower serum zinc levels compared to a control group, with the telogen effluvium group showing the largest difference. Mild to moderate zinc deficiency was found in over 34% of participants with hair loss, compared to just 1.3% in the healthy control group. Now, an important nuance here. Zinc supplementation is only beneficial when there is an actual deficiency. Taking high doses of zinc without a deficiency does not grow hair faster. And in fact, excessive zinc supplementation can interfere with copper absorption, which, as research has shown, is a nutrient the follicle also needs for melanin production and structural integrity. This is one of those cases where more is not better. Tested, confirmed deficiency addressed. That's the goal. The third piece of the puzzle is one that a 2024 study in the Journal of Cosmetic Dermatology brought into sharp focus. Researchers Durusu Turkoglu and colleagues conducted a comprehensive investigation of nutritional status in patients with chronic telogen effluvium, one of the most common forms of diffuse hair loss. They measured ferritin, vitamin B12, vitamin D, zinc, copper, biotin, and selenium in 90 patients compared to 90 healthy controls. The findings confirmed what individual studies had been pointing to for years. Nutritional deficiencies, particularly iron, B12, and vitamin D, are significantly more common in people with active hair loss than in those without. Vitamin D deserves a specific mention here. Its role in hair follicle biology has been an area of growing research interest. Vitamin D receptors are present in hair follicles, and some studies suggest that deficiency may contribute to the disruption of the normal hair cycle. A large portion of adults over 50 in the United States are estimated to have suboptimal vitamin D levels, often without any obvious symptoms. And B12, which came up in the comprehensive studies realm, becomes increasingly difficult to absorb after 50, as the stomach gradually produces less of a protein called intrinsic factor that's required to extract B12 from food. Someone can eat a diet rich in B12 and still be running low at the cellular level. So, what do you actually do with this information? The first step is not to run to a supplement store and buy everything mentioned here. That's the most common mistake, and it can actually create new imbalances while trying to fix existing ones. The first step is to get tested. Ask your doctor for a panel that includes serum ferritin, not just hemoglobin or total iron, along with zinc, vitamin D, and B12. If your doctor isn't familiar with the hair-specific context of these nutrients, it's completely reasonable to mention that research published in the Journal of the American Academy of Dermatology has documented their connection to hair loss and ask for the panel anyway. If a deficiency shows up, address it through the most appropriate route. Whether that's dietary changes, targeted supplementation, or a form of the nutrient your body can actually absorb. B12, for example, in people with absorption issues, often works better in sublingual form, dissolved under the tongue, than in standard oral capsules that depend on digestive absorption. The goal is not to supplement blindly. It's to identify what's actually missing, correct it accurately, and give your follicles the internal environment they need to respond to whatever else you're doing. Here's the honest summary of where things stand. Topical protocols, oils, serums, scalp massage can support the follicle environment from the outside. But if your body is running low on iron, zinc, vitamin D, or B12, those follicles are operating in an environment that fundamentally cannot support healthy hair growth. No amount of external intervention closes that gap. The people who try everything and see nothing are often, not always, but often, missing this internal piece. One targeted blood panel can tell you whether that's the case for you. That's the difference between treating the symptom and understanding the actual cause. If this gave you something to think about, drop a comment. Have you ever had these levels tested specifically in the context of hair loss? Or is this the first time you're hearing that standard blood work might not be catching the full picture? Those responses genuinely help shape what comes next on this channel. Everything here is for educational purposes only. Before making any changes to your supplements, diet, or health routine, especially if you're on medication or managing a health condition, talk to your doctor first. See you in the next one.